Hey guys, what is up? Welcome back to another episode of Unfiltered and Functional. I'm your host, Mans, and I'm here with my bestie, Sash.
Hello, hello.
And we've got another wonderful podcast for you this beautiful Monday. Hopefully, it's beautiful. Hopefully, it's not raining wherever you are in this world. Even if it is raining, though, hydration, homie. That's a reminder from God to drink your water.
I like that.
Yeah. Sash, how you doing today?
I'm doing great.
Good. How are you with your water today?
Pretty good. I'm about two of these bad boys in. Gonna drink some more right now. Thanks for the reminder. Everyone
Yeah.
take a sip of water.
Guys, if you're listening, chug. All right. Now that we're all a little bit more hydrated, totally unintentional segue, by the way. But I figured this is pretty appropriate topic wise because we're going to talk to you guys today about IV therapy. It's definitely been, I think, it is not super new. It's been popular. I see lounges pop up more and more and more everywhere, or even like, what are they called? Mobile, where they like come
Yes,
to
yes.
you, or even at festivals now it seems like there's like a little tent set up for people to get IV hydration, which I think is a genius idea. That's a really good idea. But the bottom line is IVs are no longer just like in the hospital or urgent care. You have access to it now without technically needing to see your primary care because they've been more popular, and Sasha and I have both done it. I think we both like it. I don't want to speak
Yeah.
for you. Okay. Because I definitely like it too. But I do want to kind of give you guys some tools and food for thought on if it should really be utilized, if you're the type of person that might benefit from it, maybe you won't benefit from it. And that's something else to know because they are pricey. It can add up pretty quick.
Yeah.
So, yeah, we'll dive right in after I tell you, hey, disclaimer, this is not medical advice. This is for educational and entertainment purposes only. Thank you for tuning into our conversation. Please also feel free to drop your own thoughts in the comments and continue the conversation. That's the business stuff. On to the good stuff. In simple terms, what is IV therapy? Well, basically, IV nutrients are going directly into your bloodstream. They're totally bypassing your digestive tract. Like if you think about taking a vitamin as a supplement in a little capsule, pop it in your mouth, swallow it, it has to get digested by the body before the body can absorb it and use it. And that also means that your body is not going to be using 100% of it. Your body goes through some processes. Some people don't have really good digestion, so they might not be fully absorbing it. If you get an IV, that bypasses all of that. So you're going to be, in theory, absorbing way more of what you're getting in an IV. That being said, it does not automatically make them better. It just makes it a little bit faster for you to kind of get the benefit. So I think reasons they've become more popular is because it's super convenient and we live in a world of convenience and like gimme, gimme, gimme right now, right now. I think wellness culture has kind of taken over and biohacking is really like popular right now, social media. And if you are an athlete, IV therapy isn't really new, but I think it's being shown more on social media. And so that's kind of bleeding also into like the wellness culture. IVs as recovery means from like training sessions. And then there's also kind of like the subcategory, I'll say for like wellness spas where it's like get the beauty IV or like the youth or the anti-aging.
Yeah, yeah, yeah.
Yeah. Yeah. So it does like I get it. It makes it really attractive. Sash, what has been your favorite IV that you've gotten so far? Because you've gotten a few, right?
I've gotten two or three, but to be so completely honest, the two first ones that I got were because I was sick and it was essentially just it was a cocktail blend of some sort. I could not tell you exactly what it was, but I know that it was like loaded up with vitamins. I'm sure it was like vitamin C loaded up just to kind of help like immune system wise. And then the last one that I got was we talked about this in the Aura Ring, like where when we talked about the Aura Ring, I got a notification on my Aura Ring that my body was showing major symptoms and I was like feeling exhausted and depleted and it was right after my birthday where I had a drink or two, and then the next day was our engagement party where I was going to be around a lot of people. So I got worried that I was either coming down on something or my body was just exhausted because I was like very low on sleep and whatnot. So I also got an immunity blend of some sort with I know that we did like a B shot in there as well and like a couple other things, but again, I can't tell you exactly what it was because it was just like yeah, whatever's gonna make me feel better. Thank you. Load it up. But yeah, I mean, I woke up the next day feeling great, so that was awesome.
Yeah. And that's actually really cool because that is something I want to touch on with this is the fact that you woke up and felt good, which means that you were you needed it.
Yeah, I needed it. I
Yeah.
know my body needed it.
Yeah. Whereas sometimes I think people go and get an IV and they think that they need it and then they walk away and they're like, I don't really feel any different. And that's I'll just dive into it now. If you're one of those people that goes and gets an IV and you walk away
Just
from it
because.
and you don't feel any different, you're probably somebody that didn't need it. And I hate to say that because then it's kind of like a bummer that you spent that money, but that is just the reality is not everybody needs an IV. If you have like a really solid nutrient status, you eat a really healthy diet with plenty of variety, you're well hydrated, you're probably going to walk away and not feel anything, which is great because that means you're already doing everything good. But then
Yeah,
also like save yourself a couple $100 and, skip it, spend that somewhere
yeah.
else.
Or if you're just like getting it because you're tired, like get a little extra sleep.
Yeah,
Get
which
the
isn't,
caffeine a little earlier. Chill out a little bit. Don't go out drinking next weekend again. Like, I think
yeah,
that's where the difference is.
which is another one of my points is that you can definitely use IV therapy if you do go out drinking or if you aren't well rested or anything like that. But if you buy an IV package and you're kind of using that to band-aid your behavior, guys, we're already going to call you out. Don't do that. Get your
Yeah.
get your shit together, get those foundations in place, and then the
Yeah.
IV can be like a little treat, you know? It's like pastries and stuff. It's a treat. You're going to get it every now and then. You're not going to eat a pastry 3 times a day every single day and expect to have pristine optimal health.
Yeah.
Like the exception being like younger men because hello, their genetics and metabolism as a whole generally, but
Yeah.
I shouldn't even say that because we have so many metabolic issues now, but I digress. Back on the IVs. So the first ones that you kind of described, a lot of places typically do have like immunity blends, which are really great. So if you're somebody that maybe you travel a lot for work and you're at the
Yeah.
airport all the time, or if it's like the changing of the seasons and your immune system is super sensitive to like allergens, or if you have kids and they're in school and they're bringing home everything, these would be like pretty good examples of like when you could maybe utilize an IV if you're feeling something like come down. And one of the more popular ones and ones that we will typically give in a hospital environment or an urgent care environment is called the Myers IV.
I've heard of it before.
We've also, God, don't quote me on this. This is how long it's been since I've been away from bedside. We used to, I'm pretty sure this is the one we also call the banana bag
Oh,
because it's bright yellow because of the vitamins that are in it. So we have to put like a brown cover over it. But if you like peek under the cover, it's yellow. And it's typically what we would give to people that come in extremely intoxicated and we're trying to sober them up a little bit with like a shit ton of vitamins. So just because you drink, this should not be a band-aid to make you feel better. So if you do need help, please seek help. I can also drop a resource in our description box just because we're mentioning it here. But the Myers cocktail in general is if you are extremely dehydrated, if, alcohol is one option, but like let's say if you've been sick and vomiting all night, that's another reason we would be extremely dehydrated and deficient in some vitamins. That would be probably a good choice and something that you would get if you did go to the hospital. I think touched on it too. A couple of the other ones are like the beauty IVs where they put biotin in
Mm,
it for like collagen and vitamin C, glutathione, which I do want to mention really quick.
I was gonna want to mention glutathione too, but you go first.
Okay. I was going to say people get caught up in marketing hype that glutathione is going to detox your body. I want to chop that shit right up because your liver detoxes your body. You don't need glutathione to detox your body. Glutathione is an antioxidant that's super, super powerful and it will support your liver. But that is like a myth I want to punch in the face is that glutathione is not going to do some magical detox.
Blueberries are also antioxidants.
Eat your antioxidants. Yeah. What were you going to say about glutathione?
I was gonna say I agree with you 100%, 100%, 100%. But there are times when I think that it could be beneficial. And don't quote me on this because I did my research, but I was also kind of desperate because I was on antibiotics after my breast augmentation. And the day after my breast augmentation, I started drinking my gut drink again, as per usual. But because I was on antibiotics and I had to be on antibiotics for a week after, I started doing pumps of glutathione in there. And although I know that the bioavailability of that wasn't as good as if I was to go get a glutathione shot or a glutathione IV, it still helped. I think it could have been placebo, and even if it was placebo, placebo still helps. So whatever the case may have been. But
Bless up.
huh?
I said, bless up.
Exactly. But I truly experienced like the most minimal amount of bloating and discomfort. And I'm someone who's very sensitive to medication, to antibiotics, to anything. Like I literally the color of my skin will change. Like I take that shit so my body takes it so roughly that for me to have been on them for a week and like it was not like, oh, when you feel better, you could stop. It's like, no, 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 like you're recovering from a breast augmentation, like you have to take it throughout its entire course. And I think glutathione really helped my body while I was taking something like that. So I feel like in that kind of situation where it's like if you're taking antibiotics or you took antibiotics or maybe you're having some like very serious like gut flare-ups or problems, I think maybe there it could be beneficial. But if you're kind of just like, yeah, I drink every weekend and now I'm gonna go and do a glutathione IV to help like detox my body, you should detox your body by not drinking every weekend. Like
Yeah.
that's what we should be doing. But that's what I wanted to say. I digress now.
No, that's great. To speak to the glutathione bioavailability, it is lower through the oral route, but that doesn't mean it's zero.
Yeah.
So I have a confession. Here's a little backstory. When I did my first preps, they were not ideal. And and I've kind of mentioned that before. And in the home stretches of them, I took it upon myself without my coach's okay, because like I was just feeling that shitty to go to an IV lounge basically. And I was getting B12, glutathione, and NAD shots in my glute every single week just to kind of get me through like the last 8 weeks of prep, which is crazy for me to say the last 8 weeks, but that's like how run down I was at that point.
Yeah.
And I swear to God, they like carried me through to the end.
I did the B shots also. I
Yeah.
didn't do them often, but I did them I think 3 times in the last 6 weeks between my two shows. So one
Mhm.
was like 2 or 3 weeks out from one show and then 2 or 3 weeks out from my next show.
Yeah. Yeah. And it helps for sure. So that's how it's a little bit related. What I'm saying is like the shots. So it's a little bit different than an IV because it's going into
Yeah.
muscle versus like your actual like vein, but it helped huge, huge amount. This time for prep, what I'm doing is like a troche, so like under sublingual, under the tongue,
Mm,
glutathione. So it speculatively is a little bit more bioavailable than if you took it orally and just like
okay.
swallowed it. So it's like getting absorbed through your mucous membranes. And because I just don't have it in me to do another shot every
Yeah.
single week, and glutathione burns. So that's why like
Yeah.
I would prefer to go to an IV bar and have them either give me the shot in my glute because I just hate giving it to myself in the muscle, or getting it through the IV so you don't even have to worry about the burn.
Yeah.
But
No, for sure.
that was
Little glutathione tangent.
glutathione, yeah. And then I also want to
Mention.
mention,
Mention.
since I did bring up NAD, and this is commonly something that you can have added to these IV bags when you go to these lounges. NAD is great, but I do think you need to be aware of how it could potentially make you feel or react to it. Don't quote me on it, but I think it comes in a 50 milligram push, 100 milligram push, 150. And then as it gets higher, you have to have like physician monitoring and like nurse monitoring while you're getting the infusion. And it has to be a slower infusion because it can cause people, you will feel like a tightness in your chest where like
Mm,
it like comes up so quick and you're like, and you almost feel like you can't catch your breath. This is my experience. They warned me about it. They were like, "Yeah, you might feel a little like rush in your chest and then it passes really quick." And I was like, "Oh, yeah, I'm fine. I got this." And I was getting like the lowest dose, the 50. And I remember like leaving the IV place, walking to my car, and I'm like, "What the fuck? I'm feeling some type of way." I couldn't drive. I sat in my car for like 15 minutes for this like sensation to pass. So
oh,
if you,
wow.
yeah, so if you're like someone like Sash, you mentioned you're sensitive to things, probably if you want to add NAD, just be really low and slow, like intentional
Yeah.
about it, and maybe don't drive yourself the first time until you know how you respond. And that's all I'm going to say about that because they are very common to be added to IV bags and it will have the same effect, IV bag or intramuscular injection. Sasha already mentioned when IVs are helpful, you're dehydrated, you're hungover.
True.
Yeah. If you are exposed to heat and you have like heat illness, migraines,
Mm.
fibromyalgia, and like pain with that or dehydration with that.
I have a question. You said
Yeah.
heat exposure.
Hmm.
What if someone has like a really bad sunburn?
Yeah.
Yeah, right? That would help.
Yeah.
Mm.
Because
Good to know.
you can get at risk for heat stroke,
Yeah.
and they would give you an IV anyway. But if you have a really, really bad sunburn, you think about it, the skin is a detox pathway. You're losing, like you're emitting a lot of heat from wherever that burn is. And because of that, you're also losing water in your body.
Mm-hmm.
So then that kind of spins into the dehydration part of it. So yeah, if you have any kind of like sunburn that's like really bad, you could probably benefit from this.
From an
That
IV,
probably,
yeah. No, that
yeah.
makes sense.
If you have absorption issues or gut issues, like an IBS flare up, this could be helpful. Athletes, post bariatric surgery, post any surgery, honestly, could be really helpful. Things that I want you guys to be made aware of, it is technically a medical procedure. When you go to these IV lounges, you are signing a consent. You are giving them consent to enter
Inject.
enter your body. Keep that in mind. It does come with risks. You could get an IV site infection. You could get super bruised, which I had one time. I had like
I had that one time too, yeah. Crazy bad bruise.
mine was like a week before peak week.
Oh,
And I was like, I'll get an athletic IV bag because they also have those. I was like, thank God I'm getting tan. I look like I'm ill. But just considerations as well. Like I said, they're not for everyone. So if you have heart disease, if you have kidney disease, and you have to take into consideration your fluid status, probably not for you. If you have like diseases like that, where you have to be really sensitive about your potassium intake, probably not for you. Those are the things that I really wanted to touch upon. Sasha, is there anything else you want to add about IVs?
I mean, I think that, we've done a really great job explaining when it's good to use them, when it's not the best. Then at the end of the day, like this, like anything else, is just a tool. It's just an add-on. It's something that I don't think should be abused or leaned on as a crutch unless you are extremely, extremely nutrient deficient, travel sick, traveling, whatever the case is. And like even there, I feel like if you're eating your nutrients, if you are it really just falls back to if you have a strong foundation, like you don't need to do IVs as often. I feel like I've maybe gotten, yeah, the last time that I got one was this last February, and the time before that I got one was like 3 years ago. God bless you, on the truth.
Thank you.
So I don't think that it is something that is like necessary for you to do once a month or every couple of weeks or whatever the case is. I think that it's very person to person. But again, if you are consuming your nutrients, if you are living a healthy lifestyle, if you are not treating your body like an asshole, like you don't need to spend that kind of money on an IV.
Mm,
And you would get away much better with spending money on good groceries, on a coach, on guidance, on support. Like maybe it's not, maybe the problem isn't that you're so dehydrated. Maybe the problem is that you're dehydrated because you're not drinking water. Like, you know what I mean? So rather than spending $300-400 on a freaking IV bag, you can, I don't know, drink some water, add some salt into it, get some electrolyte packets. Granted, I don't want to take away from anyone who uses it and really benefits from it. I've used it, I've benefited from it, you've used it, you've benefited from it. But it's also like that was almost like a last resort where I was like, I actually, the last time I did it, she came to my house and did it at my house, which was incredible. It was amazing. She's great. So if you're in the South Florida area and you need someone, reach out to me. I'll send you her information. She's awesome. But yeah, I mean, I don't think that it needs to be in your daily routine. It's definitely a great tool and should also be used appropriately. That's what
very
I
well
got.
said. I agree. I also have a little confession because I didn't have a bachelorette party, obviously, but I was like, man, if I did, I think I would have liked to rent the Ivy Lounge by me. They have like rooms and they like have recliners and like it's like
Yeah,
set up. I was like, man, if I did have a bachelorette party,
it would end there.
come on, girls, let's go get hydrated and then let's go to Barnes and Nobles and let's get a coffee.
I
Like,
love that. And it's funny that you're talking about the bachelorette party because I was gonna wait until we ended the podcast to say this to you just like off the record, but I also don't care. I just got an idea to maybe ask her if she can come to the wedding venue either the day of the wedding or the day after to do IV for, I mean, the day after probably for the groomsmen and the groom. But the day before for like, and for maybe even the day after, because then we're going to be traveling for half the day and just like being in the plane and around a lot of people. So I was like, I was actually just thinking about that, like, huh, maybe like before or after the rehearsal dinner, I can do like an IV. Like that would not hurt because I'm going to be around hundreds of people at the wedding. So,
yeah,
and
shit.
hugging everyone and whatnot. So that was actually a good idea. I'm
I
gonna
mean, I'm
text
gonna
her.
be there too. Let's like, does she do discounts for groups?
Probably, possibly.
All right, let's talk more
Possibly.
about this offline.
Yeah,
Uh,
off the record, off the record.
yeah, if any of you listening want to join in on the IV party,
Seriously.
yeah. No, girls' night. Guys, thank you so much for tuning in. If there is any part of this conversation that you do want to continue, please drop it in the comments or connect with us on our social medias. Those will also be in the descriptions. If you or someone you love is struggling with alcoholism or substance abuse and maybe talking a little bit about like the Myers IVs here, triggered that. I also want to drop a resource there too for AA or for Al Anon, I think is a family support. And guys, if you could give us a thumbs up, give us 5 stars on Spotify, that would be wonderful. Check out Sasha's podcast on Sunday, Sculpt Sessions, and we'll see you guys next Monday.